So did you know 12% of people will suffer from abnormal thyroid function sometime during their lifetime? Did you also know that women are 8 times more likely than men to have an abnormal thyroid function? And the most common symptom by which the abnormal thyroid function is diagnosed in women is by having abnormal periods. So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So today we will talk about how does the thyroid or the thyroid dysfunction can affect your periods. So thyroid is a small gland which is located in the front of your neck, wrapped around your windpipe called trachea. It is shaped like a butterfly, smaller in the middle and has got 2 wide wings. Thyroid gland produces 3 important hormones: thyroxine, which is T4, triiodothyronine, which is T3, and calcitonin. All these 3 hormones control the vital functions of the body, your metabolism and your reproductive hormones. There is another important hormone called TSH, thyroid stimulating hormone, which is secreted by anterior pituitary gland. It actually controls the production of thyroid hormones. It tells the thyroid how much T3 and T4 to make. So if your thyroid is producing less amount of thyroid hormones, now pituitary increases the amount of TSH trying to stimulate the thyroid gland to produce more hormones. So this means that high TSH means underactive thyroid or hypothyroidism. While if your thyroid is producing excessive hormones, now the pituitary reduces the amount of TSH trying to downplay the thyroid gland. So low TSH means overactive thyroid or hyperthyroidism. Another important thing to know is iodine. Now this comes from seafood or foods like iodized salt. This is something which is required for making T3 and T4 hormones. So let's first talk about hypothyroidism, which means thyroid gland is not functioning well, is not producing adequate amount of thyroid hormones. Now this causes fatigue, tiredness, depression, constipation, dry and flaky skin, brittle nails, falling hair, muscle pain, joint pains and weight gain. Hypothyroidism is also associated with early puberty, heavy periods, frequent periods, painful periods. It can also cause infertility and abortions too. So then, what causes the hypothyroidism? The most common cause of hypothyroidism is autoimmune, which means certain antibodies or certain immune cells form in the body which actually work against the thyroid gland and prevent it from doing its job of producing the thyroid hormones. For example, Hashimoto's thyroiditis. Genetics and family history also plays a role. Environmental toxins and pollutions also may cause hypothyroidism. Too little iodine in the diet also may cause hypothyroidism. Surgery and radiation on the thyroid gland, cancer of thyroid gland, certain medications like amiodarone and lithium also may cause hypothyroidism. Then let's talk about hyperthyroidism, which means that thyroid gland is producing more hormones than what the body needs. So the person may feel shaky, she may have tremors, anxiety, palpitations. She may actually feel very warm. The appetite is more. There is increased tendency towards diarrhea, and despite eating more, the person tends to lose weight. Hyperthyroidism patients typically have delayed puberty, they have shorter periods, scanty periods and sometimes absent periods. So the causes of hyperthyroidism could be once again autoimmune, infections of the thyroid gland, which is thyroiditis, tumors of the thyroid gland, and too much of iodine in the diet. And also, very important to know, hypothyroidism is much more common than the hyperthyroidism. So now let's understand how does the thyroid dysfunction can affect your periods. Number one, both hypo and hyperthyroidism can cause disturbed ovulation, progesterone deficiency, and hence irregular periods. Second, both hypo and hyperthyroidism are known to affect the pituitary hormones like prolactin, FSH, and LH. Third, hypothyroidism is known to impair the insulin sensitivity. That is why as high as 30 to 40% of PCOD patients have associated hypothyroidism. Hypothyroidism also causes weight gain, which further increases the chances of PCOD. Also, PCOD patients have a higher chances of autoimmune Hashimoto's thyroiditis. Hypothyroidism also decreases the coagulation factors in the body, leading to heavy periods, and hyperthyroidism increases the coagulation factors in the body, leading to scanty periods. So it's very interesting actually to note how hypothyroidism causes heavy periods and hyperthyroidism causes scanty periods. There is also an early stage of hypothyroidism which is known as subclinical hypothyroidism. Here, only the TSH is elevated and the thyroid gland is still able to produce enough thyroid hormones. Without treatment, this would ultimately progress to overt hypothyroidism, and it is very important to treat this also, especially if you have any menstrual problems and if you are planning for a baby. So now let's talk about the treatment. So treatment of hypothyroidism is by taking a medication called levothyroxine. This replaces the thyroid hormone which your thyroid gland is not able to make. So remember, it is a replacement medicine. It is not a curative medicine. Most of my patients actually ask, ma'am, for how long do I have to take this medicine before I can be cured of this? Remember, you have to take this medicine regularly and keep monitoring it with your TSH levels. So the dose of levothyroxine actually is dependent on your TSH level and may have to be titrated based on your age, weight, and if you are pregnant. Then the treatment for the hyperthyroidism actually includes use of drugs like methimazole, propylthiouracil, radioactive iodine, and sometimes even a surgery on the thyroid gland.
So what are goitrogens? Goitrogens are naturally occurring substances found in certain plant-based foods. These interfere with the iodine uptake in the thyroid gland.
So people who have hypothyroidism should ideally avoid cruciferous vegetables. Now these are broccoli, cauliflower, cabbage, turnip, kale, mustard. So they usually block the uptake of iodine into the thyroid gland. You can actually reduce their intake. You can either steam or boil them before taking. Then even onions, raw onions contain goitrogens like quercetin and propyl disulfide. So if you are fond of having onions, it's not a good idea to have them in a raw form. You can have them boiled. Then even soya foods contain isoflavones like genistein and didazein. Now isoflavones also in some studies are known to increase the hypothyroidism. So what are the natural ways to fix your thyroid? So first is diet. So avoid packaged, processed and refined foods, avoid trans fats, alcohol, take a healthy homemade diet. If you are having hypothyroidism, avoid goitrogens. We spoke about them a while back. Make sure that you are exercising reasonably. Remember, over-exercising is bad and following a sedentary lifestyle is also bad. Try and reduce weight if you have hypothyroidism. Make sure that you are taking that me or self-care time. Work on your stress levels. Try and do some meditation. Many times we have spoken about the importance of good sleep on Maitri. So make sure that you're having adequate hours of good quality sleep. Yoga is also known to help in the thyroid disorders. There are certain asanas which can help in fixing your thyroid. So Sarvang Asana, Halasana, Setu Bandhasana, Matsyasana and Bhujang Asana. So thyroid disorders are actually hormonal disorders but are most of the times diagnosed by a gynecologist when a woman comes to us with irregular, heavy or scanty periods. So if you are diagnosed with a thyroid disorder, please do not take it lightly. Take your medications regularly and have a regular follow-up with your doctor. And once again today, if you found this information useful, please do not forget to like, share and subscribe to Maitri, and we will see you soon.